Common running injuries, injury prevention, and biomechanical causes by Briana Lester, ICT200 Final Project. This presentation should examine common running injuries found in running community, the prevention of injuries, and the biomechanical causes of said common injuries. Common injuries of running include twisted ankles, stress fractures, muscle sprains, muscle strains, shin splints, and iliotibial band syndrome, later referred to as IT band syndrome. Prevention comes in many forms, and athletes should stretch before and after any form of physical activity. Common running injuries include twisted ankles, knee pain, shin splints, muscle strain, muscle sprain, IT band syndrome, and stress fractures. Ouch! That hurts. Seen in this image are highlighted areas of the kinetic chain that often experience pain when running. The first biomechanical cause has to do with foot strike patterns. Runners with a rear foot strike pattern experience a stronger magnitude of force on the heel than runners of a forefoot strike pattern. Rear foot strike pattern refers to the runner's first point of contact being their heel. This image shows different foot strike patterns and the force that is created through each one. Here's a normal gait analysis as well. Abnormal gait patterns, running form, and stride length are also all important biomechanical factors to consider when running. All three of these biomechanical factors can affect the entire kinetic chain when running, thus causing injury. You should always look out for abnormal shifts of the spine or pelvis, pelvic, torso, and leg rotation, internal knee rotation, a hip moving in and out from normal position, and hip flexion and extension. The study cited below implies that an increased internal knee rotation and an increase in hip adduction throughout the running stance are both biomechanical factors that may put you at risk for IT band syndrome. Future research is still needed to continue to determine this relationship, including information on Q angles and hip flexor strength. For injury prevention, you should always wear properly fitting equipment, like the running shoes you wear. You should always warm up before exercise, cool down after exercise, and support the full kinetic chain when running. Running form should also be considered throughout the run, and proper recovery and rest should be taken between workouts. All in all, further research is needed to determine the best injury prevention for common running injuries. Each study mentioned above has its own limitations, the primary limitation always being sample size. They're overall not large enough to make assumptions for the entire population, thus needing further research. Running is a vastly growing community, as is the study of biomechanics. Here are a list of my references throughout, each being a different study. Thank you for watching.